the Diabetes Per Charcha. And right now we have with us a very renowned doctor, Dr. Pranab Pathak from Guwahati. Request you to kindly give a brief introduction to our audience.
Hello, I'm Dr. Pranab Pathak, consultant diabetology, Nemcare Super Speciality Hospital, Guwahati, Assam.
First question to you is, sir, what is the role of insulin in diabetes? Does insulin is compulsory for all the diabetic patients?
Insulin is an anabolic hormone and it is required for our diabetic patients. However, having said that, it is not that each and every patient who is suffering from diabetes will require insulin. Now, insulin helps in controlling the blood sugar level, but for management of diabetes, it is very necessary that patients adopt a healthy lifestyle. They need to exercise regularly. They need to take a healthy, nutritious diet. And it depends on patients to patients' blood sugar level, based on which we decide whether the patient will require insulin or tablets. Now, it has been seen that most of the patients do respond very nicely with tablets. However, some patients may require insulin at the early stage if their glycemic status is not satisfactory or if their baseline HbA1c, which is the measure of 3 months blood glucose, is on the higher side. Insulin helps in controlling the blood sugars, but many patients do respond even very nicely with tablets also. Some patients, of course, may require both insulin and tablets.
Another question to you is, sir, is the early stage of diabetes, is it reversible?
Yes, to some extent, diabetes can be made reversible only if the sugars are not very high. HbA1c is not very high, but for that, the patient needs to adopt a healthy lifestyle. They need to exercise on a regular basis. And if medications are given to them by the physician or doctor, they need to take it as when advised. In some stages, in small percentage of the patients, it has been seen that it is possible to reverse diabetes. But what is very important is that you need to maintain a healthy lifestyle all throughout.
But does the diabetes is life-threatening? Is it life-threatening?
Now, to say that diabetes is life-threatening, we need to understand some consequences which occur as a result of uncontrolled diabetes or uncontrolled sugars, that is known as the complications of diabetes. Now, if a person's blood sugar is on the higher side and his HbA1c is not controlled, then he or she will suffer from diabetes-related complications, which can again be either microvascular complication or macrovascular complication. It can affect different organs of the body, such as the eyes, the heart, the kidney, then the blood vessels of the eyes, then the feet. So some complications can arise. They may suffer from cataract. They may also suffer from foot ulcers. And sometimes it can progress to such an extent that patients may require to ampute a part of their limb, that is, cut a part of the limb if any wound is not healing. So all these complications of diabetes will occur as a result of uncontrolled diabetes. So it is very necessary to keep the sugars under control.
Thank you so much.
𝐏𝐿, India's largest